a particular document or form without fully knowing the details or the contents of what you're signing. I want you to know that you deserve to know everything before you agree to something or before you say yes. And today, let's chat about consent. What does consent means to you? Consent generally means when you give somebody permission to do something or you allow something to happen freely to something without being coerced, forced, or pressured, or probably tricked to doing that thing. So today, let's talk about consent in healthcare setting. Consent in healthcare settings when a patient agree for healthcare professional or healthcare provider to do their documentation, their treatment, their care plan, assessing them, their examination, their procedure. Always know that a patient have the right to say no. If they say no, just leave that person. So we have 4 types of consent in healthcare setting. We have the implied consent, the informed consent, the verbal consent, and the written consent. Let's chat about the 4 of them. Number 1 is the informed consent. Informed consent is when a patient fully agreed after they are fully told about a particular procedure, their treatment, and they know the importance of the procedure, the treatment. They agree to it despite the risk and the benefit. That's informed consent. Verbal consent is when the patients speak, like they talk, this it's a spoken permission. For instance, when you ask a patient, can I give you a cup of tea, and the person say yes with 2 sugars please, that means they know what they want and they agree to the cup of tea. And the type of consent is implied consent. Implied consent is that when a patient use their actions, not their word. For instance, you might want to do a patient's physical ops and you just ask, can I do your physical ops please? And they just stretch their hands. Stretching their hands means that they agree to that procedure, but they are not just talking. Probably they don't want to talk at that moment. So you just need to go ahead with what you're doing because you already asked them. Some people might even roll their sleeves for you so that you know that yes, you can go ahead with your procedure. And the last one is written consent. This is when you have to sign a document after you have been informed about the consent about a particular procedure. You have to sign it. This is a physical proof that you are agreeing to that process or to that